Thank you. It's good to be back with you today. I know that we haven't been here in a few days. We've gone through dealing with the legislative process. I have read and reviewed and signed approximately 149 bills over the last 5 or 6 days. In addition to that, I have signed 6 more today, and we have 9 more due tomorrow. And we also know that that does not really include any of the appropriation bills, which hopefully will be delivered over to us relatively soon, relatively quickly. But it is good to be back with you. And it's good to be back with the people of our great state who have worked and listened to us diligently over the last 4 months. And we want to continue to work together to slow the spread of the virus. Because one of the things that we know is that across this country, COVID-19 cases are rising, and they are rising fast. It's definitely happening here in Mississippi, and we all must be on our guard. From the very beginning, we have had a simple goal in our state. Our goal has been and continues to be that every single Mississippian that can get better with quality care receives that quality care. It's the reason that while we talk about daily reporting of cases, we also look very closely at hospitalizations, at number of ICU beds currently in use, as well as those number of individuals on ventilators. Let's be honest. That mission is threatened by the rising numbers. I want to be very, very clear. Our healthcare system is at risk. This is not a risk that is a long-term threat. This is a risk that is before us, if not now, very, very, very soon. Dr. Dobbs and I have met multiple times over the last 10 days. His warnings to the public and to us have been very graphic, and I believe them. To my fellow Mississippians, we all need to believe them. Our plan in Mississippi has been for weeks to fully reopen by July the 1st. That is today. That is not happening. Our reopening is paused, and we're considering what we must do going forward. That was not an easy call. I see, I hear, and I know the cost that these measures carry. But in our state, and in many states across the country, number of cases are on the rise. Things are getting worse, not better. Frankly, and Dr. Dobbs, I want you to correct me if I'm wrong, it's not that our current rules are too loose. Our challenge is that our people aren't following even the simplest of rules. Additional orders are useless if people will not follow what we have in place now. And you and I both know that is the reality on the ground. It is not out of the question, but right now we need more cooperation, not more mandates. We need people to re-engage in the mission. If you will just do the little things, wear a mask, avoid large crowds, please do not throw needless parties, we can regain control. We might even be able to breathe easier and get back to a more normal state of affairs. But looking at the numbers and looking at the data, we are far from that now. Let's have an honest conversation with one another. None of us have been perfect. We've all done things that aren't perfectly safe. I know that nobody can survive permanent isolation. But I want to tell you, we cannot survive a wholesale abandoning of the mission. If you've let your guard down, you can rejoin the effort. You do not need to give up. You can still make a decision to help save lives or to cost more lives. Weeks ago, I warned that easing restrictions was not a sign that the risk was gone. I expressed my fear that people thought of this like a sprint rather than a marathon. That because of the initial strict measures, people would give up on the mission rather than ease up on the measures. I'm concerned that that fear seems to have been realized. My ask of you today is simple. Please just try. Please do anything at all, and it can make a difference. Do anything at all, and it can help. Do not give up. Recognize that this is not a hoax. For weeks and weeks and weeks, I came to you and said, we have 250 new cases. We have 300 new cases. Even on the bad days, until 10 days ago, rarely did we see a day in which we saw more than 400 new cases. Over the last 10 days, we've had a day with over 1,000 new cases. In each of the last 3 days, we've had over 650 new cases. My fellow Mississippians, my friends, this is not a hoax. It is a danger. It is an imminent threat to all of us. I also realize that there is no silver bullet. A shutdown did not save us. Testing hasn't and won't save us. More ventilators don't save us. Shelter in place doesn't save us. Mask mandates don't save us. Every single one of those measures, however, is a piece of the offense. The only chance we have is for all of us to try. The only chance we have to slow the spread is for all of us to take the extra effort, for all of us to not give up. There's very little in the world that I want more than to see football being played in the fall, to have our kids back in school, to ensure that no businesses are closed and that no families are shut inside their home. But I want to tell you, and maybe even I need to warn you, the only thing that I fear more than that is widespread death as a result of a collapsing hospital system. I am prepared to do whatever it takes to make sure that doesn't happen here. I'm begging you, I'm begging every one of my fellow Mississippians to please play your part. It will take all of us to make a difference. Please do not be distracted. Do not be defeated. Do not give in to despair or stop trying to protect your loved ones. We can and we will do this. There is hope, but survival is not a given. It is a decision. We have to make that choice every single day to protect ourselves and to protect our loved ones. With that, I'm going to ask Dr. Dobbs to give us an update.
Thank you, Governor, and thank you for that call to action. It's so very important at this moment. If we look at where we are in the state, today we're reporting additional 653 new cases, 9 additional deaths, total deaths at 1,082. If we consider the trends that we've been witnessing, we have seen, as we've discussed before, a shift towards a younger age group. The age group with the most number of new cases is going to be between 20 and 29. Even though that group has seen the most dramatic increase in new cases, every age group is seeing new increases in cases. It's across the board, but it's just that much more extreme within our young folks. And what we've seen time after time and time again, is it's social activity, it's people getting in the community. This is people out and about in their hometowns, picking it up from things that normally would be perfectly innocent and safe, but in the setting of a pandemic, these are things that cannot be done safely. If we look at different areas of new concern, DeSoto County and Harrison counties they both have a significant increase in cases. All the coastal counties, but Harrison County specifically, has had significantly increased activity. If we look at like the last week of May, they had like 25 cases, and then the third week in June, they had 125 cases. So we're seeing significant increase in different parts of the state where we haven't had a whole lot of cases. Hinds County's had a significant increase in the number of cases over the past several weeks. Grenada, there's a lot of activity there. So it's so very important for us to redouble, because places that have had light activity could explode at any moment. We have to have perpetual diligence. It's very simple. If we can maintain the simple things, 6 feet, a mask, and small groups only, we wouldn't be having this conversation. The virus would actually be petering out on its own. The draconian measures that we had to implement early on are not necessary if people will follow the simple rules that will keep them safe. I just can't emphasize that enough. I think I told someone, yeah, there's a fly there, but we don't have to use a bazooka. We can use a fly swatter. So why don't we use a fly swatter to take care of the problem we have? And that way we can preserve business, we can preserve our economy, and have some modicum of normalcy when we go about our daily lives. That's really all I have to add today, Governor. Thank you.
Thank you, Dr. Dobbs. If you look at our hospitalizations, they continue to climb. 579 reported today, in addition to 207 hospitalizations of expected patients with the illness, for a total of 786, which is the highest number that I have seen, I believe, throughout the entire endeavor since we received our first case on March the 11th. And what I will tell you, and what concerns me, as Dr. Dobbs mentioned, the largest number of new cases are between 20 and 29-year-olds. Historically, they have not had as severe of symptoms, which is a double-edged sword. Because if you don't have as severe symptoms, sometimes you don't even know you have it, and therefore you are spreading it to sometimes people in the vulnerable population without even knowing it. And so what that tells me is, when you look back to late May and early June, when it appears the transmissions started increasing significantly, the first 2 weeks are seeing more cases that are being reported in those age groups. My concern is when we look 2 weeks from now, we're going to start seeing more and more hospitalizations, because it's almost that second reiteration where the 20 to 29-year-old has it, and then they go give it to their 60 to 70 to 80-year-old grandmother or grandfather, oftentimes unknowingly. And it's when they get very, very sick. And so it is of significant concern to me. I hope it is of significant concern to all Mississippians. We have to redouble our efforts. We have to. With that, I'm going to turn it over to our emergency management team and our leader, Colonel Michelle.
Thank you, Governor. From the onset of this COVID response, one of the commitments that we made with the team effort with Mississippi Department of Health, National Guard, and all the folks that work is to get the state stockpile built. We're about halfway in getting that stockpile set where it needs to be. You probably ask yourself, well, why are you only halfway there? Well, commensurate with the uptick in cases that we've had to continue to dig into that as we have bought the PPE to put into that state stockpile. So the anticipation of the reduction in the cases over the summer, given that has not happened, as we've had a spike, we've had to dig into that a little bit. We continue to buy that, continue to put that stockpile in place, and we certainly have a reserve in place now and work real hard to get there. So I just end with this one thought. The team of folks have been working on that. We've done our part. Just going to ask that you do your part now to help us slow the spread of COVID so we can get that stockpile in place like it needs to be. I'll give you a quick update on the weather. Many of you know that we've had a lot of flash flooding in the north part of the state in southeast Pontotoc County, northeast Chickasaw County, and western Monroe County. Had some flash flooding there. We did do some high water rescues up there. Good job. We will continue to have a flash flood threat throughout the remainder of the day, and we do have another system that is moving through our state now that will persist and probably loiter till some parts in the morning. So we'll continue to watch that as we move through the day in that portion of severe weather. Hurricane season, we're there. We've had pretty quiet over the last couple of weeks. We are watching a system that could develop on the southeast U.S. coast later this weekend, maybe early next week. It does not at this time pose a threat to Mississippi, but just indicative that we will continue to watch systems they develop throughout the hurricane season. FEMA did approve our request to add 3 additional counties to the Pearl River flooding event that we had back in February. Those counties were Issaquena, Marion, and Sharkey County, and those counties will have until July the 24th to submit for their public assistance requests. And then finally, we cannot do the job that we do without the help of our very capable disaster reservists. We are recruiting disaster reservists on our program now, and I would ask anyone that's interested in becoming a disaster reservist for the Mississippi Emergency Management Agency to go to msema.org, which is our website. Go to the Your Resources pull-down tab, and then go to Disaster Reservists. Our online application is there now, and we just renewed and updated our contract that went into effect today. So we thanks for all. We couldn't do it without your help. Governor, that concludes my report for today, sir. Thank
you, Colonel Michelle. Let me also say this. I want to personally thank our emergency first responders, the men and women who are out protecting us every day. I usually get on days like this my first weather update at 5:30, 6 in the morning from the team at MEMA, and I really want to appreciate those individuals that are out in search and rescue mode helping protect their fellow Mississippians. They make sacrifices, and I, for one, am proud of them. So thank you to our entire emergency management team and to the emergency management folks all throughout this great state. With that, we'll have questions. Ross?
Hi, you told NPR a couple days ago that we have single digit availability for ICU beds at hospitals in the Jackson metro area. And a spokesman for UMC said it was safe to say that all of their ICU beds are now in use. And what does that mean for a non-COVID patient who goes to maybe ICU or UMC who needs critical care?
Yeah, this is the same thing we've been talking about forever. Now, UMC critical care capacity is always pretty tight, but what we're seeing now is all the big hospitals and even some of the smaller surrounding hospitals have very limited bed capacity. It varies. A lot of the big hospitals have 0 ICU beds available on a regular basis. So it's a real challenge, and it wouldn't take a whole lot of COVID patients to overwhelm the system. We've had reports of people having to spend overnight in the ER or longer, to replace ICU capacity. So, we're really, we're full up. Now, we can surge out and stuff, and some areas have looked to do that if they have to, but with all these new cases, the younger cases, as they move up the age ladder, we have significant anxiety about overwhelming the system. And it's not just about COVID patients. Now, most of the patients in the ICU are not COVID patients. It's because the ICUs are usually pretty full anyway. But it doesn't matter if you're a COVID patient or if you're a heart attack or a stroke or a car wreck. You need that same resource. It's important for everyone, and we need to protect that resource by not spreading the infection in the community.
And what does that mean? You said some patients being forced to spend the night ER?
Yeah, and you know, basically, if you have someone who comes in and they're basically ICU level patient, and you can't have an ICU bed, what do you do? And there's no hospitals around to send them to. You make do with the best you have, and keep them in the emergency room until you can get a bed, and you have people basically on ventilators in the intensive care unit for long periods of time.
To go a little more into that, Dr. Dobbs, do you have any numbers to how many people we have right now in the ICU and on ventilators? And if there's a specification for COVID-19, could you say that as well? And do you have an update with how much breathing room do we have? So what comes next if they do get overwhelmed? You know, how much leeway are we given?
And I do have that hospital data. Give me a second. I do apologize for that. I have it for the COVID patients. I don't have the number for the non-COVID patients right at my disposal. We have, it kind of reflects the illness of people we have that's younger, you know, maybe not quite needing ICU care yet. We have 579 in the hospital right now with coronavirus, ICU bed at 160 and ventilators at 85. But it's been running closer to about 90 to 100 routinely. One of the problems is once people go in the hospital, it takes 10 to 14 days for them to get sick enough to need to go to the ICU. So we don't know really what sort of pressure is going to come from that current bolus of hospitalized folks. I don't have the overall numbers in front of me, but it's something I can share at a future date of what the overall sort of admission capacity is.
So what's the leeway? How much breathing room do you think we have until we get overwhelmed?
Well, you know, the challenge is, I mean, people are going to get taken care of, but are they going to get the optimum care? And right now, one of the reasons that people do well is because they get the standard of care. They get standard quality of care where you have the right ratio of nurses to patients, you have the doctors who have time to take care of you, you have the right medications, you have the right equipment. People will get taken care of. But one of the reasons that New York had so much difficulty is they got past that standard of care and went into crisis care. And when you have crisis care, it's not as good. And that's going to be not as good not only for coronavirus patients, it's going to be for everybody. So we do have some capacity to expand and maintain within standard of care. We do have some estimates, but we're going to start doing some internal tabletops with each hospital to get a real assessment of what they can expand. What we've identified is their staffing issues, is that when they need to expand, they can't add staff to give that proper ratio of care. And so that's going to be something we'll be working on aggressively over the next week or so.
Let me just add to that. You all know that I'm someone who studies the data, and just to put things in perspective and kind of what we're dealing with and what we're talking about, and the fact that you've got to know what's happening today so that you can try to know what to do a week and 2 weeks from now. On June the 10th, we had 156 COVID patients in ICU beds. Today, we have 160 ICU patients that have COVID. So we only are up from 156 to 160. However, on June the 10th, we had 442 total patients in hospital beds, and today we have 579. We have almost 140 more in hospital beds, and something that Dr. Dobbs just said, which we talk about regularly, is rarely does a patient go into the hospital and then automatically go into an ICU bed. It takes a few days or even a week or so. And so having a higher number of those individuals in hospital beds is a leading indicator that it is very possible that the number of ICU beds that will be needed a week from now or 10 days from now will be higher than where we are today. And so those are the kind of decisions and viewpoints that we're looking into. Yes, sir.
Can you elaborate, Dr. Dobbs, on, I think people at home may not realize that people who have COVID or suspected of having COVID could be in the hospital much longer than your average hospital stay. We've heard family practitioners say 20, 30 days, sometimes longer than that, which can also really, really affect capacity. Can you kind of break that down and give us an idea of the average stay and why that is certainly something to consider here? Especially
for people who require intensive care support, it's weeks, almost certainly. And one of the things that's so important to understand about this is coronavirus causes severe lung damage, and so and specifically it causes this thing called ARDS, which you may have heard of, respiratory distress syndrome, and the lungs are full of fluid and don't function properly. And so part of the process is it takes weeks and weeks of care to support someone long enough so their body can recover. But so many bad things happen in that, the kidneys fail, people have strokes, infections, all that sort of thing. And so it's a real challenge. So having someone who's that sick for so long eats up an ICU bed for that period of time, and it makes that capacity issue so much more acute. And I think that gets to the point. People who go in the hospital for coronavirus, it's not a short stay. We've seen, 8, 12 weeks is not uncommon for coronavirus.
We've seen some recent spikes in the date of onset, system onset, that of course obviously shows when these infections take place. Why do you think that we've seen that more recently? Are there specific outbreaks in counties or areas that you can speak to? And I've got a follow-up for that afterward.
I think it's just catching up with us. We're starting to, there's always a lag between when it's spread and when we diagnose it. So if someone gets exposed, it's about a week. Someone gets sick, it's about another week until they go to the doctor, and then it's a few days for the lab. So everything's a 2-week delay on everything. So it really reflects people aggressively trying to return to normal when it wasn't time. And I'll agree with the governor 100%. It's not that the rules are not appropriate. It's that those following the rules, we're just not there. And if we can, and then if you tack on the different restrictions that are there, which are extremely reasonable, and throw on a mask and 6 feet, we would be in good shape.
We didn't see significant increases in Hines or Oktibbeha that would have taken place after symptom onset. Like we're talking about the protest that took place on the 5th and 6th. Didn't really see any significant spikes that looked like anything more than the gradual, more cases you see gradually on system onset. But again, I'm no expert. You're the expert. I play one on television. So is there, can you speak to that from the health department standpoint? Can you say conclusively that the protest that took place did produce greater numbers? Because we see on social media, these keyboard warriors are saying that it is.
We don't have any evidence to that effect, and what our investigations have revealed have not revealed any specific links to protests, right? Data's continuing to come in. Maybe it will in the future as we dig in more. It's a question that we are very interested in asking. But what we are seeing is our population centers are having increases in cases, right? It's because it's in the communities where there are a lot of people. DeSoto County, Hinds County, we're seeing increases in Rankin County, Harrison County on the coast. So the trend now seems to be a lot in populated areas, which seems to reflect where the people are, and where people are congregating. That's where we're going to have a lot of challenges. But we'll continue to look into the protest issue, and if we find some associations, we'll be certain to let y'all know.
And to be fair, the comment regarding population centers, that is not unique to Mississippi. I was on a call with the vice president. Time runs together, either yesterday or the day before. I forget exactly when it was. But the fact is, in their 7-day rolling average, the states of California, Arizona, Texas, and Florida, obviously with many population centers, accounted for over 50% of the total new coronavirus cases in America in those 4 states over the 7-day period. So what we're seeing is not unique to Mississippi, but we don't have to manage California or Arizona. We do have to manage Mississippi. So.
Yeah, back in April, y'all created the idea to have field hospital spaces, and then last week you mentioned that those hospital spaces are not being staffed. Is there any effort to try to staff those facilities so if hospitals are overwhelmed in the coming weeks that they can send patients to those facilities?
What we have, and I think this might be what we do have, convalescing centers for people who are recovering so that we can make room for other people in the hospital, and those are activated. Oh, those, well, so we have the Camp Shelby option, but the thing that seems to be the tier above that is a resource we need to use is we've tapped into our rural hospital network because they have equipment, they have oxygen, they have beds, they have staff, and so we have set up arrangements with a lot of those hospitals that when someone is at a recovery phase such that they can not require intensive medical care, such that they can leave and basically have a convalescent level of care, that we can use those other rural hospitals, and that's been our stage. And if we had to, we could go to the Camp Shelby bit. I think there's 21 rural hospitals I think that have those contracts to support convalescent care. I believe around 8 of them are activated, and we've just about filled up 8 of those. Based on the number of beds available to us. So that's kind of our go-to thing. As far as the field hospitals, I think a lot of what people think about as field hospitals is setting up ventilators in a tent and all that kind of stuff. We can do it. We don't want to, because the outcomes will be significantly worse. There's no denying it.
And let me try to put this in terms where a simple man like I could understand it, because it took me weeks and weeks and weeks. But our trauma care system is set up, it's sort of like a hub and spoke. And so if you have level 1 trauma in a rural county in Mississippi, and you go to one of our rural hospitals, they tend to then transfer you, when appropriate, into, say, UMC, for instance, or Forest General, or one of those larger hospitals that can deal with that. And so as we tasked State Medical and that entire group with setting up a system for us, we use that trauma model, and so that sometimes happens where the COVID patients with the worst symptoms sometimes are transferred into those larger facilities. But we took it a second step such that we know that there are available beds in those rural hospitals. We know that they have the capacity and the ability and the competence to be able to deal with those patients once they get over the hump. And so we're trying to use that hub and spoke model and maybe take some patients from the hub and send them back to the spoke. And so, again, we're not in a position where that is being done everywhere in the state every single day, but that is the contingency plan, is to use those rural hospitals to deal with patients. The contingency to the contingency plan is to open up Camp Shelby if and when we need to, or there's also other facilities that we have on the drawing board as well. So, Renee.
Hunter Dawkins with the Gazebo Gazette has a question.
Renee, thank you. Governor, thank you very much. A double-sided question I have for you, Governor. This morning I attempted to contact DMR at the office to see what was happening this weekend, and apparently their agency is closed. I don't know for how long, but this 4th of July weekend, and also according to other sources, there's several other agencies potentially closed for the weekend. Seeing that, I think you and I both know that the public safety concern of the July 4th weekend is a question that I have for you, if you wouldn't mind answering.
Thank you, Hunter. I appreciate that question. I can confirm that the offices of the Department of Marine Resources are not open today. As you are aware, June 30th is the end of our fiscal year. The Mississippi Legislature, the House and the Senate, have not agreed upon a budget for the Department of Marine Resources, and that is true, I understand, of several other agencies, or at least one other agency. And we don't have the ability to obligate the taxpayers of Mississippi to open that particular agency because they have no spending authority as approved by the legislature. The fact that we have just rolled over a new fiscal year is a real challenge, and I certainly mentioned that on social media earlier this morning. I know there are ongoing conversations. I have reiterated to both the Speaker's office and the Lieutenant Governor's office the importance of this issue, because the absolute worst thing that could happen, and I will tell you, I've been governor for 6 months now, and I spend most of my time every day trying to deal with contingencies. I have been today dealing with the potential contingency of there being a boating accident out in the Gulf of Mexico and not having the Department of Marine Resources and their assets available to go help people. And so it's all over a political fight between the House and the Senate, and I hope and I pray and I believe that we will get that they will get it resolved sooner rather than later. Yes, Renee.
Nick Judy with Jackson Free Press has a question.
Hi there. We are seeing municipalities now issuing mask orders and threatening business closures for non-compliant restaurants and retail outlets. Do you support enhanced local restrictions? And is there any chance of you issuing statewide mandates like a mask order as the crisis worsens?
Thank you for that question, Nick. And Dr. Dobbs and I have had multiple conversations in the recent days about what next steps we may need to take. There is no doubt that when we looked county to county and we instituted specific additional and more strict measures at the county level, that it worked. It made progress. But it's also no doubt that in those 8 or 9 communities in which we did that, we had significant buy-in by local officials, local elected officials, local business leaders, and just folks in the community. And so I would take nothing off the table. I'm not taking a statewide order off the table at this time, but as we look at the number of new cases, we're looking at it on a county-by-county basis. It is more likely that we will see additional measures and more strict measures on a county-by-county basis. But what I got to tell you is the only way it's going to work is if we have buy-in by our local people, by our elected leaders, by our business leaders, and by our constituents. And that's why we're having this conversation today. It's a hard conversation. Nobody wants to hear it. The first case we had in Mississippi was on March the 11th. That's almost 4 months ago. But we've got more cases today than we had at any time in March, at any time in April, and at any time in May. And more cases today, new cases reported, than most, at least the first half of the month of June. That's the reason we're having this conversation. The virus is being spread. And if we will do some things like socially distance, keep our mask on, don't go to large gatherings, we can make a difference. Yes, sir.
Are there any counties that y'all are looking at right now for those kind of expanded restrictions?
Well, we're certainly looking at the counties that have increased in cases. They tend to be more population centers. And so I'm not going to name any specific counties just yet. I don't know, Dr. Dobbs, if you're prepared to do so at this time or not, or just...
You know, we're still looking at it and thinking about what would be good targets. I just say it's in progress.
This question is for you, Dr. Dobbs. Governor, if you could add to it, that'd be helpful. Are you familiar with New York, New Jersey, a few other states enforcing new travel restrictions for Mississippians going to their states? They're now ordering them to immediately quarantine. And with the 4th of July coming up, with those new policies in place, just as the expert, what's your tip and guidelines for those who are traveling, to these places that's now deemed a hot spot to other states?
We are all connected in this, and that's one of the reasons why it's so important that we collectively respond. If you're a young person and you're not worried about dying, but you're going out, you're keeping somebody from visiting their grandmother in the nursing home because we can't open it up to visitation. You're keeping someone from going to New York to see someone who's ill, a family member, because now they have to quarantine when they get into New York City. Everything has consequences. And it's really lamentable that now in Mississippi we had an opportunity at the end of May. We were going down, our caseload was dropping, our R value, our reproductive rate was less than 1, and we lost our minds. And we're paying for it now. So, I'm really disturbed, but not surprised. And I hope there's not other shoes to drop, but we're all connected. What one person does affects everyone. It's the same thing with a mask. Me not wearing a mask if I'm asymptomatic transmitting, it's not about me, it's about everybody. And I know there's no people more generous in Mississippi, so let's be generous to our neighbors and do these simple things that are going to help us live more normal lives.
Can you add to those travel restrictions, Governor?
I can. Let's just remember that the state of New York has had 418,000 coronavirus cases. Mississippi only has 3 million people. Yesterday, New York reported almost exactly the same number of new cases that Mississippi reported. I would also tell you that I believe New York is a beautiful state. New York City is a beautiful city. I understand that they voted to reduce their police budget by $1 billion in New York City recently from a $6 billion budget, so they're buying into the defund the police movement, which I don't think is a smart thing for them to do or for anyone else to do. We've got to work. We've got to get better. There's no doubt about that. You know, when we looked at what was happening in Louisiana, when we had significant spikes in cases in New Orleans, we looked at and we talked about did it make sense to ban travel from one state to another. And I'll just tell you the decision I made, and I'm just going to be perfectly honest with you. I looked at the number of new cases in New Orleans, and I recognize that in our state, we have a lot of Mississippians who travel to New Orleans to work and play, and we have a lot of people who live in Louisiana who travel to Mississippi to work and play. And at the end of the day, we're all Americans, and it does none of us any good to try to decide that one state is better than the other, because the reality is we're all dealing with this, and we're going to continue to deal with this. And so, again, we had approximately 600 cases, new cases today. New York had approximately 600 cases today. So, but they can do whatever they want to do. That's fine.
Governor, a question about, today being July 1st, the start of a new budget year. It's my understanding that we don't have a budget in place for most state agencies because of appropriation bills that have not gone through. For most, if not all, I don't want to say all because I'm not sure, but I want to ask you about that. If you could comment on that and tell us where we are in that process.
Right. Well, for a bill to become law, it has to ultimately pass both the House of Representatives, the Mississippi Senate, and then be signed by the governor. And while there may have been one or two special funds appropriation bills that have been signed, that would be it. And so the vast majority of state government does not have a signed appropriation bill. Having said that, we do have a large number of bills that have been agreed to in principle by the House and the Senate, and hopefully will be headed to my desk at some point, sooner rather than later. And I think some of them will, maybe as early as today or tomorrow. But my commitment to the people of Mississippi is I'm not just going to automatically sign them. We're going to read them. We're going to see what is in every single bill. That is part of the process, and it's an important part of the process. And so they do all have a July 1 effective date that I have seen thus far, so that helps us. Constitutional agencies have the ability to operate if the Department of Finance and Administration give them that authority. That's based upon an Attorney General opinion. We've never really been here before. I've been in state government and specifically in the financial space in state government for 17 years. This is the first time we have come to a fiscal year in which budgets have not been agreed to and passed. But where we are in the process, it appears to me that as of last night, with the exception of the CARES Act bills, all but two budgets had been agreed to, had been signed. Conference reports had been signed. Not all of them had been voted on by either chamber. I know they're working today and hopefully getting most of those done. And hopefully we'll get all of them done and get them passed by the legislature and send them to the executive branch sooner rather than later.
Do you see any employees of the state being affected by that in terms of, and again, I know you don't have a crystal ball, but this being, people start thinking about paychecks, things of that nature?
Well, I mean, I can tell you with certainty that there's quite a few employees at the Department of Marine Resources who were thinking about it today because we had to shut their doors. We don't have any mechanism to incur expenditures for that particular agency, and so yeah, there are a lot of state government employees that are looking at that right now. But again, I am hopeful that the House and the Senate will come to an agreement and send us bills that we can review. And I'm hopeful that they didn't put any pet projects or anything in those bills that would lead me to be unable to sign them and to do so very quickly.
Governor, across the street right now, there's a ceremony going on with the Lieutenant Governor and the House Speaker to retire the state flag at the state capitol. Did you want to see the flag remain up longer, and have you given any consideration to the three members that you will named to this commission, and will they be reflective of Mississippi's demographic makeup?
Yeah. The answer to your second question is no. I haven't had any thought to it yet. I just haven't had time to do so. The question the way I would answer your first question is, as I appreciate the Department of Finance Administration lowered the flag on the grounds at the Mississippi Governor's Mansion first thing this morning. So that flag is not currently flying at the Governor's Mansion. The Lieutenant Governor and the Speaker are certainly free to do whatever they choose to do, and if they're taking it down right now, that is certainly their prerogative. The bill that I signed last night gave the Department of Archives and History 15 days to retire the flag, and so I think what you'll see, because we have a lot of state office buildings and other places where the flag currently flies, it'll be a process to get that done over the next couple of days and weeks. But it is not flying.
Yesterday in your announcement before you signed the flag bill, you said that there is a difference between the state flag and Confederate monuments. Well, what's the difference?
Well, actually, I didn't say that. What I said is there's a difference between the flag and monuments in general, but it's true of all monuments. The difference is a monument acknowledges and honors the past. In my opinion, a flag is a symbol of our present, is a symbol of our people, and it is a symbol of our future. That's the reason that I believe that we need a new symbol, because I believe that our new flag will represent Mississippi's future. It's the reason I'm glad that the legislature mandated that whatever the new flag commission comes out with, that it will include "In God We Trust" on our new banner. As you'll recall, I was Lieutenant Governor, and I fought very, very hard to add the words "In God We Trust" to our state seal. I was ridiculed for it. I was attacked for it. I was sued because of it. But I thought it was the right thing to do for our state, to add the words "In God We Trust" to our state seal. And I think adding "In God We Trust" to our state banner shows, and putting our faith first reflects Mississippi.
You don't see a distinction between a monument for World War II veterans, Vietnam, and Civil War Confederate veterans?
I don't. I believe that there is a group of people in this country that have gone primarily in large cities and decided that they were going to tear down statues and tear down monuments, and in many instances, they didn't even know what the statues or their monuments were for or to. In fact, they took down monuments of Christopher Columbus. They took down monuments of abolitionists. And it was really just an angry mob in many instances that just wanted to tear down anything. In a lot of instances, I would tell you that they are trying to do these things because, for whatever reason, they don't appreciate our country for what it is, which in my mind is the greatest country in the history of mankind. When you look at our state, we have a very complicated past. I understand that, but I do see a distinct difference between monuments and our state symbols. Yes.
Governor, you put on Twitter that DOR Commissioner Herb Frierson sent in his letter of resignation late yesterday night. Can you comment why he decided to do so on all of a sudden after 40 years of service for the Department of Revenue?
Well, I have not yet spoken directly to Commissioner Frierson. He did send in his letter of resignation. I spoke with him a week or so ago. What I would say, and I said this on Twitter, he was a pretty good football coach. He's a great legislator. He's done a very good job at the Department of Revenue, and he has almost 40 years of service. And so he's been at DOR, I believe, for 4 years now. And so I think given his number of years of service, and I don't know this for sure, but I have served on the board of the Public Employees Retirement System for 8 years. My guess is it's probably cost him money to come to work every day because of his long tenure and long service, and there's also other factors, I am sure. But Herb served our state admirably in a large number of positions. When I was first a lieutenant governor, Herb was chairman of appropriations in the House, and so we inherited a budget situation that was not ideal. to say the least. Unlike what we were able to leave these leaders in the House and the Senate working over the last 8 years with the Speaker and his team, we're in the best financial and fiscal shape we've ever been in when we got into this COVID, and thank God that we were. But when we came in 2012, when Herb became Appropriations Chairman, that was not the case. And so then Senate Appropriations Chairman Buck Clark and then House Appropriations Chairman Herb Frierson worked diligently for years to get our House in order. They laid the foundation, and I'm thankful for Herb, and I appreciate his work.
I've been talking with parents that are concerned right now as we're approaching the fall, and they had two questions they want me to ask you. Why should parents feel safe sending their kids to school? And Governor, will you be sending your kids to school in the fall?
The answer to the second question is yes. The answer to the first question is I think we have to get back to a sense of normalcy, but we've got to be smart about it. I believe that we can return to school in a safe, responsible way. It's not going to look exactly like it did a year ago, but I believe that in many classrooms we can properly socially distance. We can see kids being smart and doing right things. I am concerned about having thousands of people in the stands for sporting events. That concerns me much more so than having 25 kids in a classroom. And so, but I do think we can work with our local leaders. Mississippi is a state in which the local school districts have significant autonomy and significant authority. I know I've worked with the Mississippi Department of Education, and we've made recommendations to them, many of which have been taken, and we appreciate that. But we've got more work to do to make sure we get that done.
Jennifer King with Bloomberg Law has a question.
Hi, Governor. Thank you. Kind of along that same line, I wanted to ask about one of the bills coming your way from the legislature. Given the persistence of COVID-19 and uncertainty about what work and school might look like in a few months, do you plan on supporting Senate Bill 3046, which is the COVID-19 Connectivity Act, the legislature's effort to provide grants to expand broadband access that could boost educational services in rural parts of the state?
Well, what I would tell you is that, again, we have to review the bill as we have to review every bill. My staff and I will read the bills, but that was an initiative that I endorsed very early on because we do want to improve connectivity in our rural areas. I worked very closely with Senator Joel Carter, who I believe is the author of that Senate bill. He's the chairman of Energy in the Mississippi Senate. We've also worked with our friends and colleagues in the House as well, and Representative Bounds from Neshoba County was very intricately involved. But barring some unforeseen incident, I would anticipate that we'll be able to sign that bill because, again, I endorsed it even before we received money for the CARES Act. Yes, ma'am.
Paul Williams with Law 360 has a question. All right, well, Dave Elliott with WLOX has a question.
Thank you, Renee. Governor.
Hey, Dave.
Question, hope you're doing well. Another question regarding the Confederate monuments, dozens of which are at county courthouses. As a matter of fact, the Harrison County Board of Supervisors is going to take up the issue of a monument on Monday. Way protects these monuments and statues, it seems a little ambiguous. In your opinion, can county or city leaders unilaterally remove these monuments?
Well, Dave, my reading of the statute is that, and again, every one of these local elected entities has their own council, and so they have to make that decision. But my reading of the statute is that monuments cannot be moved unless they are moved to a location that is considered of the same quality in terms of number of of individuals, et cetera. And so they have to move to a place that is of similar significance. And so, I think the statute is clear on that. That's something that that was passed long before I was ever involved in state government. And so that's an issue that I think that we are going to need to address in terms of legislation potentially over the next several weeks and months, or maybe even in the session that begins in January, and that's something that we'll work through. But I do want to just be clear that we as a state need to recognize that we have had a very difficult conversation over the last several weeks regarding our flag. It is a conversation that was very hard, but it was a conversation amongst family, and I believe that family conversations can often be hard. But the fact is, many of the people who were adamantly opposed to changing the flag were less so because of the flag itself, but more so because of what they believed to be the slippery slope of trying to erase our nation's history. And I will tell you that when I have talked to individual Mississippians, and I have done it a lot, I made the decisions that I have made in the last 10 days because I've heard Mississippians talk. I've heard their hurt. I've heard what they see when they look at our current or what was our current symbols. And so, but I will tell you that I don't believe, and I reject the notion that we ought to remove monuments at this point in time.
Going to give it another try with Paul Williams at Block 360.
Yes, I apologize about that previously. My question is also about the retirement of Commissioner Frierson. The DR said that he only first let you know yesterday that he was leaving. In his letter of communication, did he give you any specific reasons for his departure? And also, when do you plan on naming an interim replacement?
Well, thank you for that question. He did not give me any specific reasons as why he was leaving, but I'll give you a little hint. Yesterday was June 30th, which is the end of the fiscal year. Lots and lots and lots and lots and lots of people, including yesterday, Colonel Chris Gillard at the Mississippi Highway Patrol, retire on June 30th because from a retirement standpoint, it is advantageous to do so. Now, he did not tell me that, but this is something, and I've been involved in state government for a few days. It is very, very, very common that if someone is contemplating retirement, it makes sense from a retirement standpoint not to do it on May the 1st or on July the 3rd. June 30th is the most advantageous day to do so. Now, I can't answer for him. I'm sure he'd be happy to answer those questions, but I feel certain that that had something to do with it. Well, it appears it is 3:30. Thank you all for being here. To my fellow Mississippians, please get back in the game. I know that on the cable news networks, COVID-19 isn't that popular now. It's not that sexy. Not a lot of people are talking about it. I'm here to tell you it is real. It is hurting people in our state. It is growing, and it is of concern. Stay safe out there. God bless Mississippi.